All right. For those of you who don't know me, I'll just introduce myself. So I am a clinical health psychologist and board certified behavioral sleep medicine specialist. Earlier this year, I left academia and founded Mind Body Sleep because I wanted to bridge the gap between healthcare and mental health and use a more integrated and holistic methods that you don't traditionally see in Western medicine. So my practice includes treating sleep disorders, treating different mental health difficulties, and the psychosocial implications of chronic health disease as a health psychologist. And I use an integrative and evidence-based approach. And just some fun sleep facts about me. My circadian chronotype is the bear. And if you don't know what your chronotype is, I highly recommend Googling it and learning more about yourself. There's 4 chronotypes. There's the bear, the lion, the dolphin, and the wolf. So interesting to know what kind you are. And it's mostly for fun, but it is based on some sleep and circadian research. So there's some validity to some of this stuff. My optimal sleep window is about 10:30 to 6:30 a.m. And if you know me well, then you know that my morning routine is absolutely sacred. So that's just a little bit about me. And I welcome you to go to my website and learn a little bit more about mind, body, sleep. But for today's talk, Sleepology, I want to get to 3 main points. One, I want to teach you a little bit about the basics of sleep. And I want to provide you guys with some practical strategies and tips to improve your sleep quality and what to do when you're at the end of the rope, when all those strategies you've tried haven't worked. And we'll talk a little bit more about that as well. But before we begin, I really want to get to know my audience. So I'm going to ask you guys to pull out your cell phones and to answer the next few questions via text. So you're just going to text the code to your answer to 37607. And I'm actually going to see the results here live. It's completely anonymous, so be 100% honest, and we should be able to get a good gauge of what kind of sleeper you are. And at the end, I'm going to have a little thing for you guys to review on what kind of sleeper you are, so keep a mental tally of what your answers are. So go ahead and text your corresponding answers to I go to bed and wake up consistently at the same time every day. Okay. Give it a few more minutes. All right, so it's looking like a majority of you are falling in the somewhat true category, small percentage in the very true, and a couple of you far from the truth. All right. Let's go to the next one. Same thing. I consistently get 7 to 9 hours of sleep a night. So text your answer to 37607. Hey, so it looks like a majority of you actually meet that time range, which is excellent. All right, a couple more of these. So I have a wind down routine and avoid using my phones and screens before bedtime. I sort of have an idea of what this answer is going to be, but go ahead and use your poll. As I figured, most of you guys were going to be far from the truth on that. It's hard to disconnect these days. All right, think a couple more of these. I only drink caffeine in the morning. Okay. And last one here. I can fall asleep and stay asleep naturally without any sleep aids. Okay, so based on your answers, this is what kind of sleeper you are. You're either a super sleeper, mediocre, your sleep needs a little tune-up, or I'm sorry to say, but you're a sucky sleeper. But don't fret because I've got you covered. All of those different strategies were just basic sleep behaviors and sleep hygiene strategies that we're going to talk about that can help promote good sleep health. And I will be giving you guys a lot of tips on that in just a little bit. This was mostly for fun, so don't worry. All right, so let's dive in, and I'm going to give you guys some basic sleep education. So why do we sleep? What is the function of sleep? Well, the field of sleep medicine is relatively newer in relation to other fields of medicine. So we're starting to learn a little bit more about it, but we don't really quite know exactly what the function of sleep is. We do know that sleep is a well-conserved behavior across all animals. And we hypothesize that sleep is important for various functions, such as survival. So sleep includes a variety of different protective and adaptive biological processes that our brain and our bodies need to survive. Just like we need to breathe air and drink water, we need sleep in order to survive. So it plays a critical role in immunological function as well, and we need that to stay healthy. Sleep also has some restorative qualities to it, so meaning it gives us time to sort of recharge our batteries, replenish important key nutrients that our brain and our body need and different organ systems need in order to function properly. And we actually release specific hormones at specific stages of sleep. So if you aren't getting enough sleep, or if you feel like your sleep is broken, then you are missing out on all of the important restorative qualities of sleep. Sleep plays a critical role in regulating our metabolic and endocrine systems as well. It aids in appetite control. You might find yourself getting a little munchier on days that you don't sleep well. It helps energy conservation and regulate our body temperature. And perhaps one of the most important things that sleep does for us is for our brain health. While we sleep, our brains are actually really active, and we engage in a process called synaptic pruning, which is kind of getting rid of all of the, so to speak, junk or dead neurons that we don't need. We consolidate memories, we do a lot of brain growth and development, and most importantly, I think, is cleaning out some proteins that we accumulate during the day. This system is called the glymphatic system. It's similar to our body's lymphatic system. And we go through this kind of recycling process every single night. So we all know what happens when we don't take out the trash, right? We get these accumulation of proteins and dead neurons in there that we don't need and that contribute to brain fog, memory and cognitive impairment, and more long-term early onset dementia and other neurodegenerative diseases that we want to avoid. All right, so I'm going to talk to you guys about how we sleep. You're looking at a very simplified version of what we call a sleep drive. So everybody has a sleep drive, and it's a system that helps keep us awake and put us to sleep. And so I'm going to explain this briefly here. So on this arbitrary timeline, we have two major processes, right? We have some hormones or signals that keep us awake. We call these our circadian signals. And we have a process that puts us to sleep. I'm going to refer to this as sleep pressure. As signals, hormones build and build and build throughout the day. It's like a pressure system. So in the early parts of the morning, our alerting signals are low. Our sleep pressure, we just use it all up. So once we wake up and get going, those alerting signals start to build throughout the morning. All the while, your sleep pressure signals are also building. What happens when you take caffeine or other stimulants is it suppresses the sleep pressure a little bit and pushes it back, so you're not feeling as sleepy. And then you'll see around this like 12 to 3 p.m. mark where there's this natural dip in your circadian signals. This is that time post-lunch when people think, oh, I ate too many carbs for lunch. But really, it just has to do with this natural dip in your alerting signals. But if you can push through it, then they're going to pick back up. You get a second wind, and they're going to go until the late hours of the night, around 9 or 10. And you'll see that they actually reach their peak around that time. And this point right here is what we like to refer to in behavioral medicine as the forbidden zone. And the forbidden zone basically means that people who try to fall asleep when their circadian signals are too high often can't. They get misdiagnosed with sleep onset insomnia. And really, all they had to do was wait until these signals drop off significantly. Your sleep pressure reaches its peak right then, and then you can fall asleep a lot easier. So sometimes a really simple intervention is just delaying your bedtime a little bit. This is a very simple version, but this is how our sleep-wake cycle kind of functions on a day-to-day basis, and everybody's timeline is going to be a little bit different. All right, I'm just going to say a quick note about sleep stages. We have various stages of sleep. We have REM and non-REM, and in non-REM sleep, we have 3 different stages. And this yellow part here is what we call deep sleep. I like to call it yummy sleep. And we predominantly get our yummy sleep in the early parts of the night. So it's really normal if you are a heavy sleeper in the first few hours, and then you experience a few more awakenings and a little bit more disruption in the later parts of the night. We also do a lot more dreaming in the early morning, latter half of the night. All right, so how does our body tell time? There's a few different ways, but the 2 primary ways. The primary way our body tells light, what we call a Zeitgeber, is by light exposure. So when you wake up and open your eyeballs, you get some light exposure. Light signals go through your eye. They go to your master clock in your brain, and your master clock tells your pineal gland to either start producing melatonin or suppress it. And so that is the primary way where we're going to start, our body knows what time of the day it is. The other primary way that our body tells time is through food. So our feeding schedule, and that's kind of why we call it a breakfast, right? We wake up, we eat, we tell our body this is time to start our day. And other things like physical activity also impact our body's time system, because we actually have clock genes everywhere throughout our body. So literally every cell and every organ has a clock on it, and they relay signals up to that master clock in your brain that helps tell your body how to regulate time. All right, so a little bit more about the brain. So I mentioned a little bit ago that our brain goes through this cleaning out process, and it's our body's natural method of what I call housekeeping. So in our housekeeping, we talked about the synaptic pruning. We do these protein, kind of cleans. We have these sleep need index proteins, what we call SNPs, and those help dephosphorylate or clean out those excess proteins. We consolidate memories. In fact, we actually lose about 40% of newly learned information if you're sleep deprived. So that's why cramming for stuff doesn't work. And that's why we want to actually get a good night's sleep so we can process that information and consolidate into long-term memory. Creativity and insight is also enhanced. The social barriers that maintain our conscious brain, it kind of flip-flops. And now we have parts of our brain that we're starting to use that don't adhere to those social norms. And there's a lot of creativity and insight sparked. You'll hear about entrepreneurs who keep journals next to their bedside tables and they get ideas in the night. Or for those artists or musically inclined people out there, you might find that you produce your best work in the wee hours of the night. And that's part of the reason why it has to do with your circadian rhythm. And a couple of other things, processing information continues in the early parts of sleep. So if you're someone who falls asleep to the TV on or the radio or likes music or listening to something, in the long term, it could actually delay sleep onset, prevent you from getting into deep sleep a little bit because your brain's still actually working. All right, so how much sleep do we need? This is the question everybody asks, and everyone has their own unique sleep fingerprint. Sleep is unique to each individual, but we can kind of talk in generalities about what we know based on research as the average person. And so sleep depends on a number of different things. We have to look at genetics. We have to look at your age. So sleep changes as we age. We actually need a little less sleep or get a little less sleep as we age.
74 years.
Here we go.
Gender or your sex matters. So
That's
if you're male or female, that's going to matter as well. Men tend to get a little bit less sleep in the later parts of life. Women tend to get a little bit more. Your health is also going to matter. So if you have any health or psychiatric comorbidities, conditions that you're managing. Uh-oh, I'm getting some feedback. Everybody mute themselves. Thank you. Awesome. Oh no, I still got it. Okay, I think I fixed the problem. And then our culture. So sleep is a socioeconomic phenomenon. Different parts of the world, culture dictates how people sleep and what their perceptions about sleep are, and that's going to matter on how you sleep. So there are some societal norms that we meet when we think about sleep. It's also learned behavior. So how your parents and caregivers taught you how to sleep is going to dictate how you sleep as an adult. And on a very acute level, how you slept last night is going to determine how you sleep tonight as well. And it has to do with that sleep pressure system. All right, so the CDC considers adequate sleep to be about 7 to 9 hours or sufficient sleep, and insufficient sleep to be less than 7 hours a night. And so again, if we look at the general population and we put this on a bell curve right here, we can say that most people fall within that category of 6 to 8 or 6 to 9 hours. And if we're graphing how well you function during the day, we know based on research that at 7 hours, most people are going to function optimally. So this 8-hour thing that everybody hears in the media, it's actually 7. We really want to shoot for 7 hours or somewhere within that range. And again, depending on your circadian preference or chronotype, you might need a little less or a little more. Now, if we take this bell-shaped curve and flip it upside down, we get this parabola. And now if we graph risk of mortality or risk of death, we see the same thing, that at 7 hours, your risk of death is the lowest, and it starts to go up a little as the less sleep you get or the more sleep you get. So everything in moderation. And why is that? Well, sleep loss has a lot of different health consequences. So we've already talked a lot about some of the brain and neurocognitive implications and the psychological and emotional implications. And from an immunological standpoint, sleep loss increases inflammation and it reduces the number of natural killer cells, which help fight off disease and keep us healthy. The World Health Organization is actually deemed night shift work. So anybody who goes against their natural circadian rhythm. So if you're awake more in the night and sleeping a little more in the day, this would apply to you. They've deemed night shift work as a carcinogen. And they say that it is very similar to carcinogens exposure that you would get from UV radiation, car fumes, or cigarette smoke. And they actually even threw French fries and potato chips in there. So I'm really sorry for those deep fried food lovers. But that's something to consider. And speaking of food, sleep loss does affect our metabolic health as well. Human growth hormone is decreased, cortisol, which is our stress hormone, is increased, and even our satiety hormone and our hunger hormones are depleted. And actually, when we look at the trends in obesity and the trends in insomnia, we actually see an analogous slope and curve that those two things are trending in the upward direction together. And there's no surprise there. Our heart health is also affected. So research shows that sleeping less than 6 hours a night is actually going to increase your heart risk by 66%. That increases your risk for hypertension, coronary artery disease, heart attack. So watch out for heart health there. And on a reproductive level too, both women and men's fertility decreases with sleep loss. But it's not just the amount of sleep, we want to look at quality. And there's 4 ways that we track quality of sleep. The first one is sleep, what we call sleep efficiency. Basically, how efficient are you or good are you at sleeping when you intend to? And we like to think of this number in percentages. So the closer you are to 100%, that's where I want you to be. 85%, that's kind of acceptable. So that's the number that we shoot for, is in the normal range. If you're falling asleep within 30 minutes, I actually don't like this one because the typical normal person falls asleep in 15 minutes or less. And if you wake up more than once per night, I also don't like this one because a normal typical sleeper wakes up multiple times throughout the night. We only get really concerned if those awakenings are long or too frequent. So if you're awake more than 20 minutes, that's problematic. All right, so sleep changes as we age. We all know that. We need a little bit less sleep as we begin to age. And I'm going to say a couple of things about medication here. So if you use sleep meds, and based on our survey that we did, I think there was almost half of you that said you fall asleep naturally, which is amazing. But we want to watch out for sleep medications because they only have a short-term benefit. There's no curative benefit there. It's just like a Band-Aid. They actually contribute to long-term difficulties with sleep architecture, or how you move through your different sleep stages. They could potentially have some unpleasant side effects and rebound insomnia. If you ever try to come down or off of the medication, you might experience a lot more insomnia, sleep fragmentation, impaired daytime functioning, that morning grogginess or hangover feeling, and then just tolerance and dose escalation, needing more medicine or changing medicines as a result. So this slide may be sort of underwhelming for a topic that is a little overwhelming, and I made it very, very simple on purpose. I just want you guys to remember the risks and consider the risks when you reach for a sleep aid, or if you're taking sleep aids. We know that your risk for cognitive impairment and dementia is increased twofold if you take sleep hypnotics. It's increased even more if you take benzodiazepines. We also know that you have a reduced quality of life and lifespan, so that mortality risk is increased, like I showed you before. And based on the hazard of death ratio, which is something the World Health Organization also comes up with, we know that taking long-term sleep aids is equivalent to smoking 1 to 2 packs of cigarettes a day. So I know that statistic is like very jarring, but it's true. So just think twice. So now that I've managed to scare you guys a little bit about sleep loss, what do we do about it? And that's where I come in, and I'm going to teach you guys some strategies called sleep training or sleep retraining on how to protect yourselves against those negative health consequences. All right, so I'm going to teach you guys, I'm going to give you guys the 5-finger discount, okay? So 5 remedies to improve your sleep. And I call this the REST model, okay? Trademark and copyright pending, by the way. I'm working with a colleague at UT Southwestern to develop this model more and get it published. But it basically stands for relax, reframe negative thoughts. We know excessive rumination and worry and stress and anxiety. And if you're taking that stuff to bed with you, well, that's just going to make sleep worse. Establish sleep promoting routines. Stay out of bed and time for bed. And I'm going to go into detail about each one of these. So easy to remember, rest, R-R-E-S-T. All right, so what do each one of these categories mean? So for relax, we really promote relaxation and meditation. And both relaxation and meditation actually physically change your body and brain. Your brain size changes, your neurons change, your chromosomes change with meditation. So you get a lot of benefits there: improved sleep, mood, energy, focus, concentration, increasing your lifespan, decreasing pain, disease management. So many benefits to meditation there. And we also want to make sure that you're resolving conflicts, reducing stress. Don't fight with your spouse in your bedroom or your bed. Leave your bed and bedroom to be a sacred space. Second point is reframe those negative thoughts. So we don't want you to take anxious, worrisome, stressful thoughts with you to bed. So learning how to quiet that monkey mind. So we call it the 3 C's: catch it, check it, and change it. So first of all, you want to pay attention of those thoughts, that they're actually happening, where they're coming from, what's going on, what are the triggers. Be mindful of that. And then you want to check it. So this is not getting stuck in negative thinking patterns. Now, this formula requires a little bit more in-depth training, which I do with my patients on a one-on-one basis, but we really try to get folks to pay attention to those negative thinking patterns that they tend towards and change them. And then we're going to reframe them. And we want to reframe them to be balanced, more healthy thoughts. I'm not a big one to preach positive thinking, but if that works for you, that's amazing. But I teach how to reframe thoughts so that they're less worrisome, less anxious, and a little bit more realistic. The next one is establishing sleep promoting routines. So getting your brain and body ready for sleep. So we want to begin a wind down about 45 to 60 minutes before bedtime. This is actually how long it takes your brain to transition into sleep mode. So when you facilitate that process, it's going to happen a lot easier for you. You want to include about 4 to 5 non-stimulating activities that you do in the same behavioral pattern so that your brain begins to recognize that as preparing for sleep and it starts to transition. And you can do things like taking a hot shower or bath, which helps decrease your core body temperature, where we want it for sleep. You can do some stretching or yoga nidra. I'm also a big proponent for having a bedtime snack about 30 minutes before bed. And that's especially important for people who have some nighttime arousals. What your brain actually might be doing is waking you up in response to changes in your blood glucose levels. So if you have a bedtime snack, keeps you satiated throughout the night, you might be able to prevent that. Reading, journaling, lots of things you can do in a nightly routine. But I also said I was big on my morning routine. I think it's just as important to have a wind up routine in the morning, similar to how you have a wind down routine in the night. So things that are going to energize you and get you ready for the day. All right, stay out of bed. What I mean by that is when you're not sleeping, do not get into bed. Your brain learns by your habits, by what you do. So if you are in bed when you're not sleeping, if you're watching television, if you're on your phone, if you're even reading, and you're doing anything that requires alertness, your brain is learning to stay awake in bed. It's building that connection. And we want to decondition that. So the only way to decondition that association is by not doing that anymore and only associating bed with sleep. So only two things allowed in bed: sleep and sex. And the 20-minute rule says that if you're not asleep within about 15 to 20 minutes, you want to get out of bed, go into another room in low lighting, do something boring until you feel sleepy, and then go back to bed and try again. And now you're actually increasing that association between bed equals sleepy. And this applies to even if you wake up in the middle of the night too. If you wake up, use the bathroom, get back to bed, and you can't fall asleep, after about 15, 20 minutes, get out of bed, do this process until you do fall asleep. And then lastly, time for bed. So what this refers to is having a consistent sleep-wake schedule. You really want to train your circadian rhythm to recognize when sleep should come and when it's wake time. And so despite either photo cues or exercise or meal cues, you can entrain your circadian rhythm to be consistent and recognize a specific time and pattern. And so having that consistent bedtime and wake time is really important. And in fact, your wake time is more important than your bedtime. So if you can manage to have a consistent wake up time, regardless of how you slept the night before, what time you went to bed, that's going to be better for your circadian rhythm. So relax, reframe, establish routines, stay out of bed, and time for bed. That's rest, okay? Easy to remember. And I don't want to forget some basic aspects about sleep hygiene. And I've broken it down into three kind of basic domains here. The first one is the 3-hour rule. So the 3-hour rule means don't have any heavy or spicy meals 3 hours before bedtime. So instead have that bedtime snack I was talking about. You also don't want to consume, or you want to limit your alcohol 3 hours before bedtime. Alcohol does disrupt your sleep architecture. It's going to cause arousal, sleep fragmentation, and dehydration. Instead, have a warm cup of chamomile tea. Yummy. And then you don't want to exercise 3 hours before bed either. This gets your heart rate up. You want to pick an exercise time that aligns with your circadian chronotype or preferences, or when your peak alertness hours are. So instead, at bedtime, stretch, do some yoga, and use a foam roller. And I love the foam roller because it acts as a nerve compression and lymphatic drainage and massage, and that can help with sleep. All right, so let's practice good sleep feng shui. So what I mean by that is keep your bedroom cold, dark, clean, and quiet. The colder, the better. So less than 68 degrees is what we know helps promote sleep. And we want it to be as quiet and dark as possible. So whatever you need to do, whether it's using an eye mask, blackout curtains, white noise machine, you can ask, if you win the Alexa Dot, you can ask her to play some rain sounds and keeping it clean as well. And practice good technology hygiene. So give yourself your screens and your Wi-Fi at bedtime. Keep your devices out of reach so that you're not tempted to just pick it up either in the middle of the night when a notification goes off, or first thing in the morning. You want to try to avoid your screen first thing in the morning as well. Science shows that people who look at their phones first thing in the morning, their dopamine increases, and that increases the threshold for the entire day. And it's really hard to meet that threshold for the entire day, which can lead to more anxiety, depression, difficulty managing stress. So try to avoid that screen in the morning. All right, so you might be someone who's been thinking this, had a similar little conversation in their head. What if you've already been doing all those strategies and your sleep is still not great? Well, then the next thing that we might want to talk about, if you are just doing every single one of these strategies and you've been doing it for a long time, then the next step would be cognitive behavioral therapy for insomnia, which is the first line treatment for insomnia. And it helps with other sleep disorders like hypersomnia, and some breathing stuff we can work on if you have breathing issues. But CBTI in general focus on three different components. There's sleep training, kind of the behavioral aspects of what I just talked about. We do a lot of relaxation training, calming down that central nervous system activation or overstimulation, and cognitive training, how to quiet that monkey mind and give you strategies to manage mental health overall, reframing negative thoughts, not taking those things to bed with you. Okay, what about if you're feeling excessively tired during the day and you don't think it's all due to you not getting enough sleep? What if you feel like you're getting 7 to 8 hours of sleep and you're still excessively tired during the day? Well, this could mean something else. And I want to ask you, are you breathing? Are you breathing at night? So ask yourself if you're snoring, if you feel excessively tired during the day, if your bed partner or someone has ever observed you having pauses in your breath or gasping for air when you wake up, or or like choking. Do you have high blood pressure? Are you overweight, over 65, if you're male, over 50, sorry, and have a large neck size? That could indicate that you might have sleep apnea. And it is a very serious condition that we want to make sure that you're treating. And no matter what we do for your insomnia, if we're not treating an underlying sleep condition like obstructive sleep apnea, then you're not going to be getting the appropriate amount of sleep, and you're still going to be dealing with those negative health consequences. So a little bit about obstructive sleep apnea. So difficulty breathing at night due to a blockage in the airway. So a lot of times people have difficulty breathing when they lie on their back because their airway gets a little compressed. It results in drops in your blood oxygen level and causes arousals because your brain initiates this reflex response that says, oh no, I need to breathe, and it'll wake you up. If untreated, obstructive sleep apnea can lead to several health consequences. Your heart health and cardiovascular health is affected pretty severely, increased arrhythmias, heart disease, and heart attack. We see increases in other conditions like hypertension, type 2 diabetes, stroke, and obesity. And it leads to just overall quality of life. Excessive daytime fatigue and drowsiness, yawning, I call it the yawning disease. Drowsy driving can be a problem with these folks, and it can lead to some social and emotional difficulties, and also sexual dysfunction. So men in particular, if you're not treating your obstructive sleep apnea, can lead to some erectile dysfunction. How do we diagnose this? You need a sleep study to diagnose this. And they're going to look at how many times you stop breathing and for how long during the night. Based on those numbers, they'll recommend a treatment. It might be something as simple as lose some weight and it might improve, or you might need what we call PAP therapy. The common one is CPAP, or continuous positive airway pressure. And that's what this little guy is wearing here. I know it's not the sexiest thing, but it does help you breathe and feel better. So I'll take it. Or you might be a candidate for oral appliances, which is something that your dentist would fit you for, that helps move the jaw forward and open up that airway. And in more severe cases, there are implantable devices and stimulators or even surgery. All right, so main takeaways for today. Why we sleep, basically every animal sleeps, so we want to make sure that we're doing it, and we know that it has some really important biological functions. We aim for 7 to 9 hours of natural sleep and good quality sleep, and we know that sleep affects nearly every single part of our life. All right, so rest. 5 strategies to improve your sleep. Relax, reframe negative thoughts, stay out of bed when you're not, establish routines, sorry, both nighttime and morning, and stay out of bed when you're not intending to sleep, and go to bed consistently at the same time every day and wake up at the same time every day. And don't forget about good sleep hygiene. And if you've done all those things and you still are not sleeping well, you're not alone. Sleep training takes a little bit of time and patience. There's no quick fix, and no sleeping pill is going to fix that problem for you either. And we've already talked about the risks of that. So CBTI might be the next thing for you. We want to make sure you're breathing properly, and mind, body, sleep, or me, I'm here for you. So if anyone has any questions or any needs resources or referrals, I think there's quite a few of you in around the country in different places. I'm in Dallas, Texas right now, so I have local resources, but I can certainly find resources local to you wherever you're at if you want those and want to message me on the side. Well, thank you all for attending Sleepology 101, and congratulations, because you guys are all now sleepologists. Yay. You guys now have all the strategies and techniques in a nutshell to help you start your positive sleep experience. And our next seminar, I'm really excited to announce. So this is a quarterly series. The next seminar is going to be October 11th. It's also Wednesday evening at 6 p.m. And it's going to be on nutrition and sleep, and how food affects sleep, what we can eat to get better sleep. And the presenter is going to be Megan Brown. She is a registered dietitian and one of the MBS panel experts. And so she's going to be talking about food, and in perfect timing too, because it'll be just before we enter the holidays and people start to experience lots of food stuff then. All right, so raffle time. This is exciting. You guys all ready? Okay, here's the word. Slumber. It's coming and going. All right, so I want you guys, in order to enter the raffle for the Echo Dot or the Sweet Dream subscription, please email a secret word. You don't have to put anything else, just put the word in there, to sweetdreams@mindbodysleeptherapy.com. And if you can do that by Friday, close of the day, by 5 p.m., that would be appreciated. And then I will announce the winners via email. I'm just going to do like a little raffle. So that's exciting. And now we will get to any questions and answers. I'm going to look at the chat function. So I'm actually going to stop sharing my presentation and go to the chat here. So first question was, do melatonin supplements have the same risks as other sleep aids and medications? So melatonin, take it or leave it, is one of those things that we produce natural in our body. And it's actually a chronobiotic. It helps tell our body what time of the day it is. It doesn't necessarily intended to put us to sleep, although it can have some sedating qualities in higher doses. And so those supplements that you might get over the counter don't come in those high of doses, although I always say let's use that as a precaution. It can also have some negative side effects that can cause morning drowsiness. So if it helps you, fine. If you take it at a low dose, fine. I don't, I don't have anything too much to say about it unless someone is taking a lot of melatonin. The only thing it does is decrease your body's natural production of it. So that's going to be the problem there. And yes, the email is sweet dreams at mind, body, sleep therapy. Yeah, mind, body, sleep therapy. Anyone else have any questions about anything that we talked about today? If not, you can message me on the side. I'm happy to answer emails and I'll get back to you as soon as I can. But I really appreciate all of you coming to my very first Mind, Body, Sleep, Sweet Dream Seminar event. This was really exciting. And sorry about some of the marketing emails getting kind of lost. I'm trying to figure all that out and all the technology. So please message me on the side if you have any problems, and thank you all for coming. The raffle, the word is slumber. I'm going to type it in here so you guys can all get it. Slumber. And you're going to email it to sweetdreams@mindbodysleeptherapy.com. All right. Thank you, guys.